would you tell me what we're looking at here?
I feel like we're looking at the common carotid.
Okay.
Going up or internal carotid. Is that the common? I'm assuming.
Yeah.
Okay.
So this is this is a AP view, and you just there's such variability there. In this particular circumstance, it's normal. So the external carotid artery is smaller than the internal carotid artery. I'm going to draw that here. The internal carotid artery is a little more lateral than the external carotid artery. But in many of our patients, as they have high blood pressure over many years, the arteries get stretched out, and then they can bend in all kinds of different directions. But this is a pretty typical AP view there. And so I guess the other thing is neurologic or radiologic convention rather. So for X-ray, CT, MRI, angiography, the side convention is if you're standing at the foot of the bed of the patient. So you're standing at the foot of the bed of the patient, then this would be the patient's right side, and this would be the patient's left side. So this would be the left common carotid artery and its branches over the neck. It's a little hard to tell from one picture because as the vessels overlap, it's hard to follow. But in general, the majority of the time, there are no branches coming off the internal carotid artery in the neck. So if you can pick that out, it's helpful. What about the branches of the external carotid artery here? Maybe this is a question for Dr. Field. What branches of the external carotid artery do you remember? And do you have any helpful, I know this is probably clearing off cobwebs from a long time ago, but did you ever use mnemonics or anything to think about the branches of the external carotid?
So I remember the superficial temporal artery, and then you have the superior thyroid artery. There's a facial artery and an occipital artery.
Yeah. So in this particular view, your occiput's back here. So this would be the occipital artery. We can barely see it, but there is a superior thyroid artery, right there. Other branches would be the ascending pharyngeal, that tiny branch right there. This is the lingual artery. This is the facial artery.
You have the maxillary artery also?
Yeah. So this is the internal maxillary artery, and the superficial temporal artery is here. So unless we're talking about bleeding from a base of the tongue cancer or something like that, the main arteries that we're going to be talking about from a neuro perspective would be the occipital artery. If the patient has a dural AV fistula, oftentimes that artery is very dilated because there are little branches going through the skull and draining directly into the transverse and sigmoid sinus. Of course, the superficial temporal artery, for the rare patient that needs a extracranial to intracranial carotid bypass. And then I guess in the ENT world, the distal branch of the internal maxillary artery gives the sphenopalatine branch. And so for someone with refractory posterior epistaxis, that might be something that we embolize as an alternative or adjunct to endoscopic cautery. So there we have some external carotid artery anatomy.